Depending on what stage your cancer is, you may receive anti-cancer therapy in an attempt to cure or control the disease. For curative intent, there is usually a fixed treatment period. This may differ depending on the cancer type and stage. Your clinician will be able to explain the exact time and schedule of your treatment. When chemotherapy is given to control the disease, there is an undefined duration where chemotherapy will continue for as long as it can be tolerated and as long as the disease does not worsen. If the disease does continue to grow, often called progressive disease, your chemotherapy will be stopped, and depending on your own health and wishes, as well as treatments available and the clinical opinion of your treatment team, you may receive different drugs and therapies in an attempt to control the cancer and alleviate symptoms. The length of chemotherapy treatment is affected by a number of factors, including the type of cancer and its severity, the types of chemotherapy drugs needed for treatment, the expected side effects of the drugs, and consequently the amount of time required to recover from those side effects. Most chemotherapy treatment plans, including the duration, have been determined by evidence from clinical trials, taking into account both drug effectiveness and any safety concerns. Most treatments available will be those used in clinical trials that showed significant benefit. Chemotherapy is usually not a single session of treatment, but instead involves a number of sessions known as a chemotherapy course or treatment plan. You will be told how long your course of treatment will take to be completed, and this could be several weeks or months depending on your cancer and how it is treated. A typical course of chemotherapy involves a number of treatment sessions or cycles and usually takes between 3 to 6 months. A typical chemotherapy plan consists of 4 to 8 treatment cycles with a rest period between each cycle. A cycle is defined by the time it takes for your body to recover sufficiently enough to safely receive another dose of your chemotherapy drug. You will be told how often to come in for treatment, as this will be on specific days for your particular regimen. Rest periods are often longer than the treatment periods, meaning for the majority of your treatment plan, you're not actually having chemotherapy. You may find that as you have more and more cycles of treatment, it becomes necessary to make changes to allow more time for your normal body to recover. A single treatment administration session could last anywhere between a few minutes and several hours, depending on which drug and the number of drugs you receive and how they are administered. The length of your treatment cycle can change as it will depend on the amount of unwanted side effects, as well as how well your cancer is responding to the drugs.